Welcome to ModPath Chat, the official podcast of modern pathology, featuring interviews with authors and experts on the latest science, technology, and developments in the field of pathology. Your host, Dr. George Netto, is the editor-in-chief of Modern Pathology and the chair of pathology at the University of Alabama at Birmingham. Here's Dr. Netto.
Greetings, dear listeners. I would like to start today's episode by expressing my greatest appreciation for your valuable input and feedback. So please keep it coming and feel free to provide me with any suggestions you may have for topics to discuss or experts to invite on our podcast. You can do so by using the email address journals@uscap.org. So that's journals with an S at uscap.org. So please send me some input. So moving on to today's episode, my guest is Dr. Won-Tak Choi. He's an associate professor of pathology at the University of California, San Francisco, UCSF. Great place. If you haven't visited, you better visit that department. Dr. Choi's research focuses on developing biomarkers for pre-invasive neoplastic lesions of the GI tract. Very subspecialized, Won-Tak. And we will be discussing actually his group recent study, and it's a collaboration between multiple institutions, and I'll let him tell you who. And the study is on Fundic Gland Polyps. So thank you, Won-Tak, for accepting my invitation.
Oh, thanks so much for your invitation and the kind introduction. I'm very excited to be here and happy to discuss my paper.
Excellent. So who else, before we start, to give credit, you don't need to list all the authors, but I realize this include Moffitt and University of Washington, correct?
Yeah, and I mean, my collaborator, Dr. Peter Rabinovich and Greg Lauer and Dr. Aras Medes, and those are some of the other co-authors in this paper.
Excellent. And the audience need to read the paper. That's the whole idea, and they will know everything. But let's see if in the next 15 minutes we can tease the audience into going to our website and reading this great manuscript. So give us a little background, on Fundic gland polyps. I always, when I used to do general see them, not that big of a deal. So while you're visiting the topic and reading your paper, I learned a lot. So can you tell us why you went ahead and did the study?
Yeah, I mean, you are correct. I mean, as you know, the Fundic gland polyp most commonly occurs sporadically or in the setting of FAP. But when dysplasia occurs, most Fundic gland polyp demonstrate low-grade dysplasia, but they rarely progress to advanced neoplasia. Even though, earlier study demonstrated that, dysplastic Fundic gland polyp frequently demonstrate APC mutation similar to colorectal adenoma and other dysplastic lesion in the GI tract, it was not known whether large-scale chromosomal changes or DNA content abnormality are characteristic of the typical adenoma-to-carcinoma sequence can occur in Fundic gland polyp. In fact, in our earlier study on gastric epithelial dysplasia not associated with the Fundic gland polyp, which is a known direct precursor to gastric adenocarcinoma, we reported a significant association between the presence of abnormal DNA content and increasing level of dysplasia. Almost all cases of high-grade dysplasia demonstrate abnormal DNA content, such as aneuploidy, versus only about 20% for the low-grade dysplasia. Also, in the same paper, we demonstrated that the presence of abnormal DNA content at the baseline low-grade dysplasia is a significant risk factor for subsequent detection of advanced neoplasia. So we published this article in Modern Pathology back in 2018. So in the current study, we postulated that if a DNA content abnormality is present in Fundic gland polyp, especially in dysplastic Fundic gland polyp, this may support the existence of typical adenoma-to-carcinoma sequence in the neoplastic progression of Fundic gland polyp, similar to that of colorectal and the other GI cancer. But if it's absent, this could potentially explain why Fundic gland polyp rarely progress to advanced neoplasia. So that was the reason why we did this study.
Very interesting. And to the young investigators among the listeners, the most important thing probably about a study is to design the question and to ask the right question, and that will lead you ultimately to a great study, and hopefully you will publish it like Montauk in Modern Pathology. So I'm glad you're a repeat offender and you came back to the journal with a follow-up article. So that sounds great. So then what was your cohort and how did you go about studying? You keep saying chromosomal changes. So you're really quantitating DNA. So what technique and share with our audience?
Yeah, I mean, so the design of the study is relatively simple. So we retrospectively identify 45 patients with a dysplastic Fundic Gland Polyp, including 33 FAP and 12 sporadic cases. And almost all patients had a low-grade dysplasia, predominantly foveolar type, except one patient with a sporadic Fundic Gland Polyp who developed high-grade dysplasia on follow-up. We also had one FAP patient who developed single cell adenocarcinoma arising background of low-grade Fundic Gland Polyp. And for comparison, we collected large number of FAP and sporadic cases with a benign Fundic Gland Polyp. And to assess DNA content in Fundic Gland Polyp, we perform DNA flow cytometry on 151 Fundic Gland Polyp biopsy with or without a dysplasia using formalin-fixed paraffin-embedded tissue from both FAP and sporadic cases. Also using the same cohort, we compared the clinicopathologic feature, including outcome between the FAP and the sporadic group, also between dysplastic and the non-dysplastic cases within each group. So that's the study. That's how we did this study.
Perfect. So because the setting could be sporadic and could be within FAP patient, you address cohorts, and then within each cohort you looked at some that have low grade,
and one high grade. Yeah.
And also the ones that just have a polyp without any dysplasia.
That's correct.
Right? And you looked by flow cytometry. So what were the findings?
So the main finding of the paper is that regardless of the presence or absence of dysplasia, the Fundic Gland Polyp appears to lack large-scale chromosomal changes or DNA content abnormality. We also had one case of single cell adenocarcinoma arising background of low-grade Fundic Gland Polyp in one FAP patient. Even that case showed normal DNA content. And that these findings are consistent with the previous report demonstrating that additional genetic alteration other than APC or beta-catenin mutation may be rare in Fundic Gland Polyp. In fact, other study demonstrated that dysplastic Fundic Gland Polyp typically lack activating KRAS mutation, p53 overexpression, or microsatellite instability. So I think that the apparent lack of chromosomal instability or additional genetic alteration in Fundic Gland Polyp may explain why Fundic Gland Polyp rarely progress to advanced neoplasia. So that's the main conclusion of the paper. As I mentioned, we tested 151 Fundic Gland Polyp biopsy with or without a dysplasia. Every single one of them came back completely negative for abnormal DNA content.
So pretty much they were diploid, no aneuploid.
Yeah, exactly. No aneuploid, all diploid DNA content.
Excellent. But of course, still they will have some, this is on the large chromosomal scale because you're just measuring the amount of DNA. Doesn't mean they don't have any mutations or any alterations.
That's correct.
Understanding some of them do have FAP. Adenomatous polyposis.
Yeah, so I think that, the approximately 50% of dysplastic Fundic Gland Polyp, it doesn't matter whether it's FAP or sporadic cases, they typically demonstrate APC mutation in about 50% of the cases. But that's the only mutation that has been described so far. And our study is the first to demonstrate that large-scale chromosomal changes does not appear to occur in Fundic Gland Polyp, even with the dysplasia.
So in a way, that's reassuring, and their transformation, if you will, or progression from low-grade dysplasia, but it's not nil, right? So it's not. You mentioned 3% within your FAP cohort did develop It was one case, but it still is developed ring cell adenocarcinoma, and then a little higher in the sporadic 8%, which was 1 out of 12, right? Developed high-grade dysplasia.
High-grade dysplasia, but both of them had an excellent outcome. For example, one case of single ring cell adenocarcinoma. This patient got total gastrectomy 6 months later, but there was no residual single ring cell adenocarcinoma. And another sporadic patient who developed high-grade dysplasia also got endoscopy resection, and then additional follow-up demonstrated just a benign Fundic Gland polyp without any residual advanced neoplasia. So it looks like outcomes also excellent in this case.
And just to remind our audience, in the sporadic, it's mainly following protein pump inhibitor, right, therapy?
Yeah, usually, the majority of the patient with a sporadic Fundic Gland polyp, they have a history of PPI therapy, even though it's pretty rare in FAP patient.
Excellent. And it's important to emphasize that among the ones that didn't have any dysplasia in the Fundic Gland polyp, none of them developed any.
Yeah, that's correct.
Excellent. So that's reassuring. Now, tell me, is this going to change anything in the way we do things? Do we need to report these polyps beside what we currently do? Do you have dysplasia or low grade, or just it's a matter of knowing that the prognosis is pretty good?
Yeah, I think that the main message here is that prognosis is very good. And it seems that, most Fundic Gland polyp have a low malignant potential, but I think that still FAP patient may benefit from increased surveillance with increased random biopsy sampling because, they have a higher burden of Fundic Gland polyp, and obviously some of them, many of them actually have a dysplastic lesion. So I think that this patient getting additional random biopsy may be very helpful because they even though the rate of advanced neoplasia is very low, this patient can rarely develop single ring cell adenocarcinoma, even though that never occur in patient with a sporadic Fundic Gland polyp.
Wonderful. Well, thank you. That's very interesting. And again, I will recommend that the audience go and read more details of the paper. I was surprised that, we always in this age is all genomics and sequencing, but it emphasized that, the value of flow cytometry in measuring amount of DNA and getting to some results that are very helpful and like the one, even though it proves that it's a negative, but that's an important negative.
Yeah, I think so.
So thank you again for coming on, and we look forward to your next study on some precursors. Sounds like you're very passionate about that.
Yeah.
Consider our journal again, and we may have you again on this podcast in a few months.
Thanks again for your invitation, and I really appreciate this opportunity to talk about our research, and I hope that we'll publish more paper in modern pathology also in the future. So thank you so much.
All right, thank you.
Any opinions expressed in this podcast are the speaker's own and do not represent the views of Modern Pathology, Springer Nature, UAB, or USCAP. Your ModPath Chat host and scientific director is Dr. George Netto. Producers are Christina Crow, Amber Jackson, Dr. Sarah Jang, and Dr. Catherine Ketchum. Technical direction is provided by Kaminsky Productions, music by Mitch Neubauer. Thanks to the authors, reviewers, and editors of Modern Pathology for making this podcast possible.